Hello, you're listening to Ovarian Cancer Connect. I'm your host, Dr. John Nakayama. This podcast is sponsored by AstraZeneca. Let's get started. Welcome to episode 5, Talking with Your Patient About Testing. In this podcast series entitled HRD What, HRD Why, Testing Your Ovarian Cancer Patients. I'm Dr. John Nakayama, joined today by Dr. Alex Olawaiye and Dr. Joshua Kesterson. In previous chapters, we talked about the importance of biomarker testing, including HRD testing, but what does that actually sound like when you talk to a patient? Dr. Kesterson, I'm one of your patients. You just finished my surgery. Of course, you did a fabulous job. You took out all my cancer. I'm ready to start chemo, but I don't understand what all this genetic and biomarker testing is. What do you tell me so that I really understand what's happening?
Thank you, Dr. Nakayama. This is a great opportunity to kind of level set with patients and explain to them where they are in the treatment landscape as an individual as well as in the greater population. I explain to patients that there's greater than 20,000 cases of ovarian cancer each year in the United States, and that a majority are diagnosed at an advanced stage. And the symptoms they've been having up to this point are vague in nature, and hopefully this lets them know that they're not in this alone and that they can relieve themselves of any guilt they may feel for being diagnosed at a, quote, advanced stage or not recognizing symptoms earlier. I talk to them about the pathology or how the diagnosis was made and discuss the most common types and relay to them that while a majority of ovarian cancers are what I call due to bad luck, about a fourth of them are due to a genetic predisposition where you've inherited something in your DNA from one or both of your parents that puts you at an increased risk of ovarian cancer. After this, I think we start looking for what I would call actionable items. A couple of those actionable items that I think all patients should be tested for are genetic testing, specifically and more frequently looking for a BRCA mutation. Another action item that we want to look for is homologous recombination deficiency status. We know that certain populations, specifically those that are HRD positive, are more likely to respond to therapy with PARP inhibition. So with these different data points, I think you can appreciate how we're able to individualize patient care and optimize outcomes.
I think Dr. Kesterson totally hit it on the head there. Now, I would have been convinced to get genetic testing with that. But Dr. Olawaiye, there's going to be the skeptical patient. There's going to be the patient that says, explain to me why exactly I have to do this. How do you talk to that patient, Dr. Olawaiye?
Thank you, Dr. Nakayama. One has to appreciate that when patients are going through ovarian cancer treatment in the specific scenarios that we're talking about, a lot of information and a lot of things are being thrown at them. So it's not uncommon for them to want to object to some of those things because, let's face it, as human beings, these situations can be overwhelming. So there are two types of common objections that patients can have. One is objection to the process of testing itself, i.e., why should I have this one more test, considering all the other tests that you've done on me? They might say, do I really need to have another test? The second is, am I going to pay for this test out of pocket? I will start with the first one, which is an objection to testing. My approach is to explain very gently to them the benefits of the testing and the fact that it is going to help me to partner with them in making treatment decisions. If you carry a genetic mutation, this testing can be a huge advantage to your family, especially your first-degree relatives, because they may have the same genetic mutation, and this might give them an opportunity to protect themselves. Regarding the last objection, which is whether they are going to pay out of their pockets, I always tell them that in my experience, most insurance companies, if not all of them, cover this testing, so I suspect yours will too. However, before we do the test, I would have my staff check that your insurance is going to pay for it, and we will let you know if there is going to be any financial implications so that you can make an informed choice.
I think this was a super discussion, guys. I think you hit some really important points, and I think this will help a lot of people decide how best to talk to their patients.